Hi, everyone. So I wanted to share with you about some research related to child-centered play therapy because it is highly researched. It's been researched since the 1960s, and there is just a wealth of data. And I think that's always really important because, as we know, we are responsible for using evidence-based approaches in our counseling work with clients. And so this is a highly researched evidence-based practice. So as you're going through and learning more about this, you may have some questions. It seems pretty prescribed and some of the responses are a little weird, but just know that that comes from this practice that has a lot of research behind it. So that might make you feel a little bit better about engaging in child-centered play therapy. So I just wanted to share those with you. And this is in chapter 17 of the book as well. So there's been over 60 years of research, and it's the most researched type of play therapy. And so I want to talk about some of the meta-analysis that's been conducted. So for those of you who don't know what a meta-analysis is when you look at a large number of studies. So in a regular study, you need like 150 participants or something. In a meta-analysis, they gather all the different studies. So in one, let's see, in 2001, it doesn't say how many, but you can see the other study in 2001, there were 42 studies looked at. And in 2005, Bratton's meta-analysis had 93 studies that they were looking at. So you're looking at each study. When you're looking at a study, you're reading one study. But when you're looking at a meta-analysis, you're looking at quite a few studies to get a treatment outcome. So it's a really effective way to analyze research. So in 2001, LeBlanc and Ritchie and Bratton, Ray, Ryan, and Jones in 2005 were the first meta-analytic studies to focus exclusively on the efficacy of play therapy, so how effective it is. Both studies demonstrated the effectiveness of play therapy and have contributed to the acceptance of play therapy and filial therapy in the broader field of child psychotherapy. So in the findings of both studies supported the use of play therapy as a viable modality for use with children. And LeBlanc and Ritchie's 2001 meta-analysis reviewed 42 controlled play therapy studies dated from 1950 to 1996 and found a moderate treatment effect size of 0.66 standard deviations for the 42 studies. 20 of the 42 studies utilized child-centered play therapy without caregiver involvement, and these studies were found to have an overall average effect size of 0.43, considered a moderate treatment effect. So this is a moderately effective approach. Bratton et al. In 2005, Bratton, Ray, Ryan, and Jones conducted a more comprehensive meta-analysis of 93 controlled outcome studies of play therapy researched from 1942 to 2000 that met the following criteria: a use of a controlled research design, sufficient data for computing effect size, and the identification by the author of a labeled play therapy intervention. So a play therapy intervention was further defined to include studies that examine the use of paraprofessionals, primarily parents, as well as professionals as the direct provider of intervention. And the majority of studies that fell into the paraprofessional category used filial therapy methodology. So the treatment effect size was calculated using COUN's guidelines, and they found that play therapy demonstrated an overall large treatment effect, meaning that on average, children receiving play therapy performed 0.80 standard deviations above children who did not receive play therapy on specified outcome measures. And the average age of the study of participants was 7. So you can see here that play therapy does have a large treatment effect. Of the 93 outcome studies, 26 measured the effects of play therapy conducted by paraprofessionals, defined as a parent, teacher, or peer who was trained in play therapy and supervised by a mental health professional. All studies coded to this group used child-parent relationship therapy or filial therapy, as we've talked about before. or another filial therapy training methodology. So all studies were theoretically consistent in the use of child-centered play therapy principles and skills. Bratton et al. Further analyzed this group of studies in order to explore the effect of filial therapy conducted by parents as a treatment modality apart from play therapy conducted by a mental health professional. The authors found that filial therapy or play therapy conducted by a parent showed stronger evidence of treatment effectiveness. So it's 1.15, a large effect size compared to traditional play therapy by a therapist at 0.72, a moderate to large effect size. So filial therapy is the most effective. It's the most effective play therapy that you can do. So you can be a play therapist, but if you can train those parents, that's going to have the best effect on the child. And there has been some cross-cultural play therapy research conducted. And child-centered play therapy has been demonstrated to have broad cross-cultural applications. So numerous research studies have shown CCPT to be effective across diverse cultures. School-based CCPT with Hispanic children, which was a study done in 2005 by Garza and Bratton. Short-term CCPT training with Israeli school counselors and teachers, Kagan and Landreth, 2009. Group play therapy with Chinese earthquake victims, Shin, 2002. Group play therapy with Puerto Rican children, Trossel, 1998. Brief CCPT with African American children, post 1999. Brief CCPT with Japanese children, Ogawa, 2006. And brief CCPT training for professionals working with vulnerable children in Kenya, which is Hunt, 2006, and CCPT with Iranian children with internalized problems. So that's Bayat, 2008. So you can see this not only is just a very universal approach, it's actually been tested with a variety of populations. So that's important to know as well. And so filial therapy in a cross-cultural setting has been proven to be effective. Multiple studies have demonstrated the benefits of CPRT, child-parent relationship therapy, with Chinese parents, Korean parents, German parents, Israeli parents, Native American parents, and African American parents, and Hispanic parents. So it is an extremely effective approach. So, as you continue to learn more about this and you have questions, just know that this is an evidence-based approach that's very effective with all kinds of children. All right, that's all I have for you. Thank you so much and have a great day.